Welcome to the George Washington University Hospital Healthcast. I'm Oscar Ceballos, and today I'm delighted to introduce you to 29-year-old Francis Wilson. He's a young law student in the DC area, and he had no pre-existing health conditions, and yet he got COVID-19, and he nearly died from it. Francis Wilson contracted COVID-19 back in March from an asymptomatic friend, and within weeks, he became so sick he was hospitalized, in the ICU, intubated, and unconscious. His family thought he was going to die. They even prepared to read him his last rites, and then miraculously, his body began to recover. After being unconscious, Francis woke up at the George Washington University Hospital in Washington, D.C., where he had been transported for advanced care. He attributes GW Hospital for saving his life. And I'm happy to have Francis Wilson here to share his story with us today. And even more excited to be reuniting him with his care team at GW Hospital for the very first time since he was discharged. Today, we'll meet the people who saved his life, the paramedics who rushed him to GW Hospital, the physicians who directed his care, and the nurses who stood by his side and made sure he was okay. Francis Wilson, welcome to the show. Francis, thank you for joining us today and sharing your story with our audience. Before we get started, can you first share who you are, where you're from, and what was life like before being diagnosed with COVID-19?
So pre-diagnosis, I graduated college about back in 2014, so 6 years ago. I was living my life pretty normally. As far as things that I did for fun, I loved, playing instruments. Music was a big part of my life. Loved singing. I'm a soccer player, so I'd get out and play soccer a couple times a couple times a week. Seeing a lot of friends, seeing family, just pretty much trying to do what people my age do. And aside from that, I was also working full time as a senior law clerk at a defense think tank called Institute for Defense Analyses, while also doing part-time law school at George Mason. By the time that everything started going down, I didn't have too much of a life between school and work. I was doing my best, and then once things started getting a little crazy, I started minimizing the the limited social interactions I already had at that point.
So let's go back, if you don't mind, just a moment
Sure.
too. So you've got this really packed schedule, and you clearly have goals in your life. You're active, to say the least. And for you, and I think for most of our audience, it was a shock that there's a virus called COVID-19, and it finally has hit stateside. What were your initial, I guess, reactions to that news?
Yeah, given the limited information that we knew at the time, I didn't think that it was going to directly affect me per se. But I was more concerned about potentially getting somebody, my family's sick, or where I work, a lot of our population there is also, older as well. And I was more concerned about that. And I've got a fairly large social group here in Arlington, and we've got a big group chat with, 30 of us in it. And I remember right before I got sick, telling people that this was a big deal and that we needed to start taking action now. Stop going to bars and things along those lines. I was having those conversations before I got sick.
What were your symptoms like? How did you know? Do you remember where you were? Like, did you wake up in the morning and then you felt something was off? What happened?
So I was at work when I started noticing it was. Some people have talked about like a slight cough. I wouldn't characterize mine as a cough. It was more of a like a not really a tickle in your throat, but I felt like I had to keep clearing my throat to clear something that just wouldn't get cleared. It started out like that on March 10th. At that point, I had been studying for this law test that was coming up. That It's a nationwide test that's administered a few times a year. And I had been staying up until the wee hours of the night for a week and a half studying for this thing, and I figured between just overexerting myself there and normal seasonal allergies, I was thinking, oh, this is just allergies kicking in. So I was just taking some allergy meds, and once headache started coming on, which turned into a migraine, stomach pains, etc. I started thinking something might be up, and it was at that point that I started calling out of work, and then things progressed.
I think it's important that we highlight your initial reaction to it, because I think there's a natural reaction for most people, and now there's so much more information thanks to the folks at George Washington University Hospital and their overall team there to really that helps educate the community of like what to look for.
And especially given the fact that I had no known preconditions at all. I've never had a history of asthma. I've never smoked a day in my life. And, just being generally active and healthy, figured I was, pretty much okay. And I hadn't traveled abroad. I wasn't in contact with people who had, traveled recently or anything. So even when I went in to go get tested, they made a very strong point of the fact that I was a low risk population, and they didn't even expect me to have COVID at all. So, I went and got my flu test and came back negative, and that freaked me out. But they thought it was a false negative, and they just gave me a COVID test as just a, yeah, just in case kind of thing. Told me to isolate in my room, and I was happy to do that. But that's when things started getting a little bit more real for me. And the guidance at the time that I wound up going in to go get tested was that you shouldn't go get tested for any type of flu-like symptoms unless you develop respiratory issues. And as of March 15th in the evening, I started noticing that I was having slight tightness in my lungs when I was breathing in deeply. So it was restricted to just that, but they did a chest X-ray and saw that I had pneumonia in my left lung, I believe. And
That's
so,
fast, very
yeah,
fast.
it was very fast.
Wow.
Not what I expected at all. So the way that this all progressed for me was, I go home on the 16th after getting tested. I'm a little freaked out, but I was self-isolating in my room. I mean, it's to the point where my roommates would make me food, drop it off outside my door, and then, I'd open my door once they walk away, and then, I'd gather my food and eat. But by that point, I had major fatigue. I was laying in bed all day, still trying to work. I had my work laptop next to me, but um, it was my breathing got progressively worse. A lot of the flu symptoms started subsiding. So the migraine left, thankfully, because that was awful. But my breathing became much more belabored, and it got to the point where anytime I was changing my orientation from sitting to standing or standing to laying or anything like that, I would completely lose my ability to breathe. But at the same time, you're coughing, and when I say coughing, I mean you're coughing out your full lungs. So you're doing that with almost zero ability to breathe, and this would go on for 2 to 5 minutes every time I was changing my orientation. And so I called an ambulance, and they brought me in on the 19th to the hospital, and by the end of the day, I was intubated, and yeah.
From what I understand, when you initially went to the hospital, it was at a hospital in Virginia. Then you were intubated and unconscious. While you were there unconscious, you were transported to GW Hospital. What is it like to wake up at GW when you initially went to another hospital?
So when I got put under, the doctor originally told me it was a precautionary measure. It'd only be, 5 to 7 days tops, most likely. And they were doing it just in case, my lungs gave out or something, so that they would have something ready for me immediately to respond. I had a very short memory of being put under and being transported through the hospital there at Virginia Hospital Center. Then it's all black until I had a crazy flash dream, whatever you want to call it. I mean, by this point, I thought I was dead. At that moment, that was when I finally realized that I was still alive. Then it went black again until I woke up at GW Hospital.
Francis, how would you describe your medical care from the team at GW Hospital? How did they pull you through, not just physically, but emotionally?
Yeah, oh, they were great. Everybody that I interacted with was super awesome. From what I've heard, I was the 16th case of COVID in Virginia, but I mean, they were excellent. Most of my nurses gave me their phone number because we were trying to minimize those interactions as much as possible. So I would just text them with updates if I needed anything in there, and they were always as quick to respond as they possibly could be. Everybody was super friendly, supportive. I was just so lucky to have that support there for me because you guys literally saved my life.
It seems like things with COVID-19 have changed overnight. While you were unconscious, you woke up to everyone being quarantined and the city on lockdown. What was that experience like, leaving the hospital to a completely different world?
I remember when I came out of the hospital and saw that the streets were entirely empty. I mean, I left at 5 o'clock p.m. on a work day, or what would normally be a work day.
How many
And
days later, if you don't mind me asking before?
it was 14 days later. I got this. So
Wow.
I went into the hospital on March 19th. I was transferred to GW on March 26th, and I was discharged on April 2nd. And so,
Within those 2
leaving.
weeks, a lot changed.
Yeah, yeah. I mean, I felt like I was in I Am Legend. If you've
Yeah.
seen that movie,
Oh,
just
it's one of my favorites.
it's a great movie.
Yeah.
Yeah, it's surreal to say the least. And I mean, I was also happy to see that people were taking it seriously, but it was a strange sight. I've never seen DC like that.
How has recovery been since leaving GW Hospital? Are you fully recovered or are you still on the road to recovery?
I'm definitely not fully recovered. My lungs are totally shot still.
Mm.
I mean, you guys didn't know me before this, but my voice is a lot raspier. As far as like I mentioned, I like singing. My range is shot. My breath control is shot. Going for a run, I used to be able to put out 3 miles and it'd be no real big issue. Now I make it like half a mile and I'm, heaving for breath. It is what it is, but all things considered, I'll take it.
No,
So
agreed. And look, it's honest and it's real. The fact that you're here is completely a miracle. As I mentioned before, this is a celebration of a miraculous recovery, but we are also celebrating a reunion of those who helped save Francis's life. First is Stephanie McKnight, a paramedic who received the dispatch call to transfer Francis from a Virginia hospital to GW Hospital. During the process, Francis was completely unconscious. This is the first time Francis is meeting Stephanie. So without further ado, Stephanie, thank you for joining us today. You were the first person that saw him unconscious. And this is the first time you're actually getting to talk to him on his road to recovery here. And I just want to give you a moment to say hello and say hello to each other. And really, if you can, Stephanie, we'll start off with you. Like, when you saw Francis the first time, what was it like?
So first of all, it's an honor to be here. So thank you for inviting me. It's actually kind of difficult to not get emotional because the last time I saw you, you were not conscious and had a breathing tube in. So
yeah.
it's quite a big change and really great.
Thank you also for everything that you did. It's a very really scary time, and what's crazy is I still have some memories. That's one of the only times that I have memories is like that transit period. Um, I remember experiencing physical stimuli around me that I interpreted in my dream. And I still remember people reading my oxygen levels and saying that out loud. I remember hearing my name. I remember some people opening my eye and shining a light and, and stuff. Yeah, it was a crazy, crazy experience. And I'm so glad to be able to speak with you and other people that were involved.
Stephanie, can you share the moment you and your team received the dispatch call to rush Francis to GW Hospital? At that moment, what was Francis's condition like?
I actually remember it quite vividly because, as you said, it was early in the process of this coming out. There were still a million unknowns. It was very scary. So I do remember that day very strongly. The first thing I noticed was his age. He's quite young. We're actually the same age, so that was a little bit scary. Um, and so, on the way to the call, it was very much not knowing what we were about to walk into. Francis was actually my first COVID patient transport. The nurse Rebecca, who I was with, it was three of us. I had a nurse, Rebecca, and our EMT was Jason. They had transported COVID patients before, but this Francis was my first one, so I had no idea what we were about to really walk into. Um, so yeah, there was a lot of mystery involved as to like how things would go.
So that you actually highlighted something that I think is important to note is that Francis is young. You're not your typical COVID patient, and you walk in with your team. There's still a lot to learn. At that point, we're hearing
Yeah.
that it affects primarily a certain age demographic, and who should we be looking for? Who could be most susceptible? And some things still hold true. But at that point, there are a lot of questions. So you see someone your own age, and you know that this is critical. You're bringing them from one hospital to GW Hospital, and now you get to see him today on his road to recovery. How does that feel?
It's amazing. It's actually quite a huge privilege because most people in my profession don't get this opportunity. They just drop the patient off with their nurse and their docs, and then they never get to find out what happened to the patient or, the course of their recovery. So it's quite an honor and very humbling.
And Francis, you get to see someone on the team that helped save your life. How does that feel?
It's such a good feeling. I know that when I, got out of the hospital, one of my first tasks for me that I tried doing was reaching out to various caregivers that I had just to start piecing it. Number one, to thank them, of course, but number two was to start piecing together what actually happened to me because I just didn't know, and still to this day, there's a lot that I still don't know about what actually went down, especially around March 26th when I was transferred. And so, I mean, I'm really lucky, number one, to have been able to speak with the people that I have and to speak with you, Stephanie, and everybody today. Yeah, this is I'm really just lucky.
Stephanie, do you mind sharing with our audience just how and what it's been like being a paramedic on the front line since the surge of COVID?
It's been quite a wild ride, I'll put it that way. um, just, from the beginning, going through the stages of not really believing what's going on to this might actually be real. And um, as you said before, in the beginning, everyone believed that it was just older people who were going to get really sick. And then as more and more cases start coming out, ones like Francis's case, it became quite obvious that this thing does not discriminate. It's really a luck of the draw in regards to how serious your case is going to be and whether or not you're going to recover fully. So with that in mind, it's been a process. I think we've adapted very well to using the information that has come out along the way, and we're still continuing to do that. So.
Well, we thank you for your service and your continued service. And Francis,
Thank you.
thank you for taking the time, both of you, to really take a moment to say hello and thank you to each other. It works both ways, right? Especially from the giving side of healthcare, where you get to see a success story, which is a win for everybody involved.
Absolutely.
The reunion continues. We are lucky to have Maureen Townsend, who is the ICU nursing director at George Washington University Hospital, and RN Kara Halpin, part of Maureen Townsend's team, who was by Francis' side when he was brought in critical condition. Francis, please tell me and the entire audience here more about your experience with the nursing team at GW Hospital and how they took care of you.
Yeah, the nursing team was so excellent. From day one, I know I arrived and I was sedated, but I mean, still the first memory I have, while I was sedated, there's just this memory I have of arriving. I think right around that time at GW, and maybe Kara, you might be able to answer whether I was restrained at the time that you met me. But if I was thrashing around, sorry about that one.
Why was
Yes,
he
he did.
restrained? So one more context.
So yes, you were restrained. I think we did try to take them off, and I think you tried to go for that tube, so you went right back on the restraints.
Oh, interesting.
It's funny. So we typically, and it sounds bad, we'll restrain a patient, but it's ultimately for their safety. We don't want you reaching up and going for that tube because it can actually do more harm than good. So a lot of patients are restrained because our natural instinct is to reach for the tube and pull it out.
Apparently, I still tried to take my tube out later. So
Yep.
I apologize for sedated me.
That's all right. We forgive you.
Let's talk about the team and morale. Kara, if you don't mind, what's it like for morale when you get to see a wonderful patient like Francis on his road to recovery? And for the most part, we hope that everybody gets to get on this path and on this road, but that doesn't always happen. But it must be great to see Francis where he is today.
Yeah, absolutely. It's always a great day when we get to see patients go home. Even little steps in their treatment is a huge success for us. Like you're following commands for us. That's great. But getting to see these patients go home is a great thing. And I think, Francis, you've done a very good job of helping and kind of promoting that you can go home. And it's fabulous. It's a feeling that a lot of us do or don't get very often at times. And I think it's really great to see it. And our hospital actually implemented a song. It's called Here Comes the Sun. Every time a COVID patient was discharged, it plays over the like the loudspeaker, so you know someone's going home. So you hear it and you just kind of smile and carry on with your day. That another person gets to go home to their family, gets to go home to their pets, their loved ones. So it's special.
That's beautiful. Thank you for sharing that. Francis, how does it feel to be reunited with your care team? Tell me, just hearing about that song, gets me emotional. But and I
Yeah.
imagine people listening right now, they're having the same experience. That song was played for you.
It's pretty surreal to know. I am just so lucky to be here. I'm lucky that I had such a great care team, throughout my entirety of my stay there. And it really is a whole team effort. This wasn't just any single nurse, any single doctor. It's the entire team from the cafeteria up. And I'm just so lucky to have been here and to be able to give back as well, and to be able to sit here and thank you too, directly to your faces. I really can't express my gratitude enough. You guys saved my life, and I know for a lot of you, this may just be you may view this as just doing your job, but I need to echo like it's more than that for me. This has given me a second shot at life. This allowed me to finish law school. This allowed me to go home and hug my parents, see my hedgehog again. It's I'm just so grateful to be here, and thank you for your role in that.
Maureen, can you tell us what it was like to have Francis brought in, especially in the condition he was in such an early COVID-19 world?
Yes, I definitely remember that day, but first I'd like to say, Francis, it's wonderful to see how well you're doing. I remember the call that day because we were all surprised at how young he was, and we wanted to make sure that he was going to get the best care possible, which we always do for all of our patients at GW that come to the ICU. We have a great team that I work with. We work very collaboratively with all of the physicians, the respiratory therapists, everyone involved in our team. And when Francis came in, we just went and did what we do and made sure he got the best care possible. And as we see right now, he's doing wonderfully.
Kara, you also have worked with other COVID patients.
I have worked with many COVID patients since your arrival and you doing so well. I've worked in the ICU. I also did a lot of work on the med surge floors with all those patients and helping with the equipment that they need to make sure those patients get out. So it's been a long road, and I think it's been a long or yeah, a big learning curve, I should say, for a lot of healthcare, and the world itself. I mean, we were in a situation where not many of us knew what was going on, and we just kind of had to work together and do the best we could.
I think everybody's still learning here, and we're
Absolutely.
trying to share that with the rest of the world. And there's a big reason why we're all here to celebrate really Francis' road to recovery, but also the people and the team that continues to care for him and cared for him.
Oh, the care was incredible. Every single nurse there, I've kept in touch with at this point, at least since I was awake and could, know who they were. The care was top notch. I understood that there was a lot going on, and but still, everybody was so quick to respond whenever something happened. And again, especially in such a time when nobody really knew exactly what to expect. Nobody knew what exactly was the best care. Um, we had best guesses, but I have nothing but admiration and respect for what you guys do and the how well you do it. This is my first real experience in a hospital, aside from I've broken an arm or two. But this is my first time in sort of any sort of intensive care at all, and I just have so much more respect and now knowledge about what your duties are, and you guys absolutely knocked it out of the park. I'm really lucky to have gone to GW.
That's super sweet. Thank you for taking the moment to really thinking two more members of your wonderful team. Speaking of the team, Maureen, if you don't mind, this is a two-part question here. One is, for the viewers and listeners right now, can you talk more about the innovative technology used on patients in the ICU, such as ECMO and advanced ventilators, and how that really pertains to COVID patients these days?
There's a lot of research out there at the time when Francis came in as to what's the best way to treat the patients. And we're lucky at GW, especially in the ICU, that we are very aggressive with the treatments that we apply to the patient and trying innovative ideas to help the patient. And as you mentioned, ECMO is one of them, ECMO being extracorporeal membrane oxygenation, to where we pump oxygenated blood or help assisted, so we can get the most oxygenated blood to the patient to help them recover. In addition, there's various other forms of non-invasive ventilation that we were very aggressive in trying on patients to help them oxygenate, to help them get better and to get over the infection. We did everything possible in terms of the medications that were being tried out there. We worked very closely with the physicians in the best way of administering these medication. But on top of it, just doing that nursing care, doing that touch, being there for the families, being there for the patients, experiencing and anticipating what they may need so we can make sure that we, in collaboration with the physicians, give them the best care possible.
Fantastic, fantastic. This is great context for anybody that's watching or even, wondering what it's like and what type of care GW is able to give their patients. As I know and your team is top notch. So thank
Yes.
you for taking the time today. The reunion continues with Francis's main physicians, critical care medicine Dr. Danielle Davison and infectious disease specialist Dr. Hannah Axelrod. Both of these doctors played and continue to play a critical role in Francis Wilson's road to recovery. Dr. Davison and Dr. Axelrod, we appreciate your time today. Dr. Davison, can you please share the moment you began caring for Francis Wilson?
Sure, Francis, so wonderful to see you.
Thank you.
I think when we received the phone call that Francis should come over to GW for a higher level of care, I think sort of the first striking thing about the situation when he came into the room, I was just amazed at how young and healthy he appeared, and that this shouldn't happen to someone of his age and of his degree of health. So that was one of the first striking things that we had seen, and we had heard from more reports. This was early on that this should really happen to older people, but that was clearly not the case. And then we started some really more investigation looking into his oxygen levels and the way the ventilator was working with him. And we were really fortunate to be able to manipulate the ventilator and to work with his system to see that he was clearly at the end of this process and that it was his time for recovery. So we were so amazingly pleased to be part of that process.
Francis, can you recount the first time you met Dr. Davison and the faith that you had in her, making sure that you got home okay?
So, number one, thank you so much for joining. I'm so glad to be able to speak with you. I think at the time that I met you, it must have been early on. I don't remember. I remember meeting so many people, and it's tough too because everybody was wearing a mask too, and just trying to remember who was what, especially while in my state, it wasn't exactly the easiest. But I do remember waking up. I do remember both your name and Dr. Axelrod's name as people who were involved with my care. Um, but I mean, I just remember waking up and just thinking how lucky I was to be even there. But when I woke up, I still didn't really understand how bad my case was. I remember my first thought when I woke up is I need to get out of ICU. There are other people here that need this more than I do. I'm fine. And at that point, I really had no idea how not fine I was. But thank you again for everything that you did.
And Dr. Axelrod, if you can bring you into this conversation, look, you understand. We've discussed before on prior productions that this is serious and it's affecting more people than we thought it was going to affect. But with the right care, we can have success stories like Francis. And what does it feel like for you to see Francis on his road to recovery and thriving as much as possible?
It is absolutely wonderful and makes me deeply, deeply happy. Uh, Francis, when I first met you, you were in the ICU under Dr. Davison's care, and you were, I believe, under sedation at the time. The first time we spoke was actually a few weeks later when I called you to check up on how you were doing. And I remember saying something along the lines of, "You have no idea who I am, but I promise I've spent a lot of time thinking about you." And it was wonderful to have that conversation and to hear the voice of someone that last I'd seen you were still requiring a lot of assistance breathing. It really brought it home to me that we can have success stories with this disease. And this was early on in our process of learning about COVID-19 as clinicians. I shared with Oscar a few weeks ago on a previous podcast that at that time in the year, this was in our minds. It had very recently been a disease that happened far away and that might be of interest to people who study obscure infectious diseases or who are involved with the health of travelers. We were quite concerned that it was coming in a huge wave to us where we are, and that we didn't yet know what the best practices were and what the effective treatments would turn out to be. So it was a gift to see you do so well.
Thank you. Again, thank you so much for, your care that you gave me. You guys literally helped save my life. So I'm very lucky to have, had the degree of care that I had, and probably lucky that I got in there fairly early before, our hospitals got completely flooded.
I know that at GW Hospital in particular, you have had protocols in place where I could safely say that going to GW Hospital is one of the safest places to go during this pandemic, whether there's a surge or not, because you have all these touch points and frankly procedures in place to keep everyone safe, whether you're a patient going to the emergency room or you're going for any type of frankly just general care. If you have to see your doctor at the hospital, or you've been putting off any type of elective surgeries, now is the time to go. And if you could elaborate a little bit more, Dr. Axelrod, about what's in place.
Thank you so much for bringing that up, Oscar. We have kept up many of the protocols that were instituted as far back as March. We're still doing them. We do universal masking for all healthcare personnel who work in the hospital. We've still been reducing the number of people who can be in one place at the same time to decrease the chance that somebody might be breathing the virus into the air. We do symptom screening for anybody who enters the building. So you will be greeted by a greeter who will have a little forehead thermometer and will ask you how you've been feeling. And for patients who are going for any type of procedure where they might have anything invasive done or be in close proximity with healthcare staff, they are actually asked to do a COVID screening test a few days in advance. And if it comes back positive, then we counsel them and we postpone the procedure. Now, that said, there are things that are critical and time sensitive that should not be put off because that might hurt your health in the long run. So we've been encouraging and reaching out to our patients to say, we've changed our layout, we've changed our staffing, we've changed our safety protocols. It is safe to get the healthcare that you need, and we want to be in communication about how to do it.
Great. And Dr. Davison, if you could elaborate a little bit more about how important it is to come in and get those procedures done now, to make sure these are taken care of, especially before the fall, because we don't know what the future holds at the moment.
Oh, absolutely. To reiterate what Dr. Axelrod was saying, we have enough protection, PPE, and safety here. We feel very comfortable with our protocols, and it has really become commonplace for us. So we feel very strongly. We have patients, not just COVID patients. We have everyone, and we want to take care of everyone at the right time. And when people delay their care, that leads to worse outcomes. So yes, we absolutely ask the members of the community, if you do not feel well and you need health care, we are here to provide that for you in a safe manner.
Yeah, there's so much misinformation out there that,
Absolutely.
frankly, still needs to be cleared up. And this is one of the reasons we're providing this podcast through George Washington University Hospital, so we can educate the public and let them know that it is safe to come and get your care. Dr. Davison and Dr. Axelrod, thank you for your time. I'm going to let Francis just say thank you one more time before we transition out. But I know that you continue to care for Francis. You continue to stay in touch. So Francis, please, the floor is yours.
Yeah, well, I just want to thank you again from the bottom of my heart. I, wouldn't be here without you guys and without the staff here at GW. I know that, it can be frustrating when especially for you two, when many of your patients may not have had the same success as me, but regardless of outcome, your guys are giving them the best shot that they have at life. And that's what's really important. It makes all the difference, not just to me, but to my family, my loved ones, my friends. from my heart and from them all, I just want to thank you.
Great. Thank you so much for those kind words. And Dr. Axelrod and Dr. Davison, thank you for your time.
Thank you so much. It's been a privilege and an honor.
Thank you. And thank you for your words, Francis. Thank you for spreading the word and informing others to avoid the danger that's still out there.
Of course, it's the least I can do.
Francis, lastly, let's bring the entire team back on the screen if you don't mind. And if anybody has any parting remarks, please feel free. You're more than welcome. And maybe we'll start with Dr. Davison. Can you share a little bit more about how you and GW continues to care for patients like Francis?
Sure. Well, I'm so thankful for the medical community, for GW, for the amount of PPE that we have so we can take care of patients safely. I'm grateful for my colleagues, the collaboration, but I'm most grateful for the patients like Francis who come back to say thank you and for these success stories. We continue to do that, and we continue to have success stories, and that's what brings us back to work every day, and I really do appreciate it.
Dr. Axelrod, please, a little bit more just overall from your lens and how we're doing, what we can do to continue staying safe and again, bring home more patients and bring home more people to their families like Francis.
Thank you, Francis, for being out there from the early days of your recovery to share your story with people who need to hear that the danger is real, even to young people, and that it is a process for recovery. It's not like a flu that you can get over in a week. I remember our conversation earlier in your recovery course because you asked me, well, how long does it take until I get back to my normal state of health? And I said, I'm going to be humble about this. I have no idea. And a couple months later, I hate to say it, we're asking the same question. There's a lot about this virus that we have yet to learn. I have an announcement that I've waited to make until now, and I wanted to make it for you. We would like at GW to start taking a more active role in understanding how people recover from this disease. So we are actually starting a post-COVID recovery clinic in which we will meet with patients sometime after their discharge and their recovery, and have a team of specialists working together to try and illuminate that question that you asked me a couple months ago. I hope to get to some answers.
Wow.
That's awesome.
It's fantastic. Absolutely.
Please keep staying safe in the meantime.
I will, I promise.
Thank you all for joining us and making this day so special. It's not easy to coordinate so many high-level professionals into one day, and Francis as well. But I really believe that the story needed to be amplified, as Francis was kind enough to come on and share his story. So Francis, and to all the medical professionals on the call today, thank you so much for making time for us.
Thank you all.
Thank you. Be well, Francis.
Yes,
Thank you.
please be well.
Francis Wilson's survival story highlights how important it is to take the proper precautions during the current pandemic. It also highlights the George Washington University Hospital's commitment to providing safe and critical care to all patients. For more information, including videos and other podcasts, visit gwhospital.com.